We hear so much about AI, especially its promise in really critical fields like healthcare. The idea of AI helping nurses spot patient emergencies faster, maybe even saving lives.
It sounds transformative, absolutely.
But does that promise really hold up when you put it under the microscope? That's what we're diving into today.
Yeah, there's a fascinating new study out of Seoul National University Bundang Hospital.
Exactly. They've empirically tested AI in these super safety critical settings, and we're going to unpack what they found. Okay, so let's maybe step back for a second. Historically, when we've brought in digital tech in hospitals, things like medication ordering systems, even clinical
The
alarms,
electronic health records, all that.
yeah, they often came with benefits, sure, but also new risks, right? Things nobody really saw coming. Sometimes it even led to, patient harm, alert fatigue, maybe interfaces that were just too complex.
Definitely. It's not always a simple upgrade.
So this study was basically asking, could AI, even sophisticated AI, bring similar sort of hidden challenges?
Precisely. And what's really interesting is how they designed it. They looked at 3 different AI tools, all aimed at helping nurses spot patients who might be deteriorating quickly.
Okay.
And it wasn't a small test. We're talking 450 nursing students plus 12 licensed nurses. They had them look at 10 real historical patient cases.
Wow, it's quite a setup. So a mix of experience levels looking at these AI recommendations.
Exactly. They wanted to see how this human AI system actually performed under pressure, considering that mix.
And what was the big takeaway? Did the AI help?
Well, yes and no. Here's the really striking part. When the AI was right, performance absolutely improved. Nurses did better. That's the good news, what you'd hope for.
Okay.
But when the AI was misleading, it didn't just not help, it actively degraded their performance.
Degraded. How badly?
Get this. The maximum negative impact, the degradation, was almost twice as big as the maximum improvement.
Wow. So the harm outweighed the help when things went wrong.
Significantly. And crucially, when the AI was most misleading, the nurse's level of concern for patients who were genuinely crashing was basically indistinguishable from their concern for non-emergency patients.
That's chilling. It really muddies the waters for the clinicians.
It absolutely does. It suggests the AI could potentially mask critical signals if it's subtly wrong.
Which brings up the whole idea of AI explanations. People often say, well, if the AI explains itself, that fixes it. Did that help here?
That's what many expect. That transparency is the key. But the study found something quite counterintuitive, showing the AI's explanations alongside its recommendations. It didn't significantly change the results. People were still led astray when the core advice was bad.
So the explanation didn't rescue the situation.
Nope. And even more surprisingly, in some cases, showing only the explanation could actually make performance worse.
Worse?
Well, it suggests that explanations aren't some kind of magic bullet. It's not just about seeing the AI's thinking. It's about how we as humans process that information, especially when it might subtly conflict with our own judgment or just lead us down the wrong path.
So, okay, connecting this to the bigger picture, it sounds like just having a smart AI isn't enough.
Not even close. The study really hammers this home. AI capabilities alone do not guarantee a safe or effective human AI system.
Right. You can't just optimize the algorithm in a lab and expect it to work perfectly with a person in the real world.
Exactly. Optimizing the AI piece doesn't automatically optimize the whole system, the person and the AI working together. Think of it like testing a new autopilot system for a plane.
Okay.
You wouldn't just test the autopilot software on its own, right? You'd put it in the cockpit with a pilot and see how they interact, especially during turbulence or emergencies.
Yeah, you need to see the partnership in action.
That's the core message.
Oh, wow.
So based on this, the researchers proposed 2 absolute minimum requirements before you deploy AI in these kinds of critical settings.
Okay, what are they?
First, you have to empirically measure the performance of the people and the AI working together, not separately. You need to understand that joint system.
Makes sense. Test the team, not just the players.
Precisely. And second, you need to test across a whole range of cases. Good AI performance, okay performance, and especially cases where the AI does poorly or is misleading.
So don't just rely on average accuracy scores.
Definitely not. Aggregate scores, like overall accuracy, can hide really dangerous failures. Think about it. A doctor or nurse is responsible for that specific patient in front of them, not the average outcome across thousands.
Right. One critical error, even if rare overall, can be catastrophic for an individual.
Exactly. So those rare but severe failure points must be understood before going live.
So the bottom line is really about demanding rigorous, real-world testing of the human AI team before deployment.
Without a doubt, it's about responsible implementation.
Which leaves us with a big question, doesn't it? Given all this, how do we need to rethink training for doctors and nurses? How do we prepare them to work effectively with AI, especially knowing it might sometimes be subtly dangerously wrong?